We're joined today by Dr. Vanessa Sheppard with VCU Health and with Reba Hollingsworth, CBS 6 colleague and anchor of CBS 6 This Morning. It's great to see both of you.
Hi, Jess.
Hi, good to be here.
Dr. Sheppard, we are delighted to have you today. An incredible conversation coming up, coordinated through American Cancer Society, you with VCU Health, and we're talking this month, of course, about breast cancer awareness. And the conversation that's coming up, Virtual Breast Health Equity Summit. And this is something that has always been critically important and top of mind, but right now the conversation is front and center.
Absolutely. I think that we have been concerned about the disparities for breast cancer for quite some time. And we are at a point now where we recognize that we want to see greater strides. That despite the fact that the gap has narrowed between, say, African American women and white American women, it hasn't narrowed enough. That there's about a 39% difference in overall mortality for breast cancer. And it is a time for action. And given what's happening in our country at large and right here in our own state, that we recognize that any disparate outcomes is one death too many.
Mm-hmm. It's really very, very interesting in that these statistics, these disparities between white women and Black women and breast health existed certainly before the COVID-19 pandemic. But what's happened during this time is that the circumstances have been so exacerbated that it's providing an even sharper point on those disparities, isn't it?
It absolutely is. When you think about what's happening with COVID-19 and the inability for individuals to see their primary care physicians as they normally would, we are finding that individuals are putting off screening out of necessity at some times. And we're expecting to see disparities emerge with regard to early detection from cancer. And so COVID has definitely highlighted the existing disparities and exacerbated them, particularly for individuals that are minority and medically underserved populations.
Reba, you facilitated a conversation earlier this year for American Cancer Society, very well attended. A lot of folks had the opportunity to interact and ask those questions that are top of mind. You'll be moderating this virtual Breast Health Equity Summit. Talk us through what that means to you and what you hope to achieve out of a conversation like this.
Well, when we did the other conversation was earlier this year, and that was COVID-19 and breast cancer. And that was just a good conversation because kind of like what this one's going to be like, just to have that wealth of knowledge on this panel. And for you, anyone who's watching can ask those questions. So I think it's good just to get the awareness out there. I think maybe some of us, we're close to this and we know about disparities, but there's some people who may not know that disparities exist between races or socioeconomic backgrounds or even where you live. So I think it's good just to kind of put that information out there and for anyone just to ask that question or those questions.
And really just something as simple as building the awareness, because as you say, if you're not aware that there are disparities, then how do we even begin to address?
How do you fix it?
How do you address that issue? Dr. Sheppard, as an ACS-funded researcher with VCU Massey Cancer Center, I know this area is critically important to you and you're very proud of the work that you're doing with VCU Massey Cancer Center. Can you talk us through the research that you are working on?
Absolutely. So I am very pleased and thankful for the funding from the American Cancer Society. And my research is focused on breast cancer. And this particular study that's funded by ACS is focused on promoting adherence to adjuvant therapies among African American women. And the goal of this study is to test an intervention in a randomized controlled trial to see if we can improve patients' communication with their provider and then uptake of appropriate treatments. And we're excited about this study. It will be targeting to include 400 African American women and will be the largest study of its type. And we're very pleased that we can do this study here in Virginia through Massey's commitment and the commitment of the community.
Absolutely. A driver of conversations, research, and change. Thank you so much for making time to be with us, Dr. Sheppard. We appreciate it.
Thank you. Thank you.
Absolutely. And Reba, looking forward to another great conversation, the Virtual Breast Health Equity Summit on October 29th.
Thanks, Jess.
Absolutely. We'll share all
All right. The American Cancer Society presents the Virtual Breast Health Equity Summit. That's coming up on Thursday, October 29th from 12:30 p.m. until 2 p.m. Later today, you will find a link to all the details on our website at WTVR.com/VTM. Jess, we often talk about women and breast cancer, and but men also can get breast cancer as well, as we've learned over the last few years. And I think, I'm in that category along with everybody else who has actually been touched by this disease in one way or another. My mom suffered with breast cancer. I have two sisters, and, everybody can relate to breast cancer. But as Dr. Sheppard says, there's a big disparity there between African-American women and white women, probably rural people that live in rural areas versus cities. So some ground needs to be made up.
Undoubtedly, right? And off the top of my head, I'm not entirely crystal clear on the distinction or the differences between the diagnosis with men and women. How often? I think some of the statistics we see pretty regularly: 1 out of every 100 breast cancers diagnosed in the United States are with men. So certainly this impacts both. We have very close family friends who, almost an adopted uncle of mine, who has gone through that journey too. And it's, whether you're man or woman, it's incredibly shocking. It's shocking for you, shocking for the family. So you want to make sure that the playing field is leveled, as you said. And these conversations are a big part of that. I think they were happening before, maybe less frequently and with less attention. So now they are closer to the forefront, which is good, so that all of us are having dialogue about this, because it's so impactful and can make such a difference to get the conversation going. And right now, this pressure cooker of the COVID-19 experience has limited our ability to follow up on those appointments, to make those appointments, to get out and be on this journey, or our comfort level of being out and seeking attention. So it's almost caused it all to bubble over, I think, in a positive way.
Yeah, I have a very dear friend who's a nurse who does mammograms. And she's always told me that, we really need to get the word out a little bit more. And it seems like every October, we're like talking about it a lot. And she's like, yeah, but people kind of tune out stuff the rest of the year. And as you said, with COVID, we know that people are putting off doctor's appointments and things they need to do. This is something that really need to kind of turn up and make sure that it happens and turn out as well.
Because think about it, at this point, if this pandemic journey began in March, where we all made such big adjustments to our everyday lives, if you had an appointment during those early months that you postponed and thought, I'll reschedule that when this is over, we're still in the midst of so much and not back to what we knew as our regular routines. But yet here we are 6, 7, 8 months later. And couple that with the 3 months at the beginning of the year, you could be pushing a year since your last mammogram at this point. And they have, the recommendation is happening annually. So hopefully, I know October, we do hear so much, it's Breast Cancer Awareness Month, and it should happen throughout the year. But if we've inspired that, I need to check on that. I need to check on that date. I need to go make my appointment. Hopefully that happens today.